Hi, so my name's Emma Lawrence, and I'm the Mental Health Innovations Fellow at the Institute of Global Health Innovation at Imperial College London. So thanks for joining me today or this evening or whenever you're listening to this talk about the impacts of climate change on mental health. Okay, so climate change. If you're coming to listen to this talk as part of the London Festival of Climate Change, I presume that you're interested in climate change and probably also deem it to be a crisis. Um, we know that there's more carbon dioxide in our atmosphere than at any time in human history. And we know that 2/3 of extreme weather events in the last 20 years were influenced by humans. So earlier this year, it seems like a lifetime ago now in some ways, but in my homeland of Australia, there were severe bushfires. There's been droughts, uh, more frequent and extreme hurricanes, fires and floods as part of this worsening climate crisis. On the other hand, mental health and mental illness is often in the headlines as well, and is also deemed a crisis because we know that rates of mental illness and mental ill health is worsening around the world, with depression set to be the leading cause of life years lost to disability. So, what's the relationship between these two crises? Is there any? For some people, that relationship might be obvious on some level because if you're coming to listen to this talk and you're interested in climate change and you've read the news or seen these sort of events unfolding around the world, you might have some strong feelings in response to that, and maybe your own mental health in some way has been affected by the knowledge or awareness of the climate crisis. For other people, though, it might seem initially a stretch to try and put these things in the same basket in any sense. So what I'd like to do tonight is lead you through some of the relationships between, or the potential impacts of climate change on mental health and mental illness, because as we know, climate change will affect every aspect of our society, but more and more we're understanding how the climate crisis is a health crisis. So we're currently living through a global pandemic, and the reason that I'm not giving this lecture to you in person as I would have when it was originally organized, is because we're all living through a crisis. So how does a crisis, whether the current crisis or another personal crisis you've experienced, make you feel? And we see that now in the mental health implications of the COVID-19 crisis. You might have experienced it yourself, or you might see that there's distress rising in the community, and particularly those with pre-existing mental illnesses can have exacerbated symptoms. So we know that in these situations, it's often the most vulnerable who are the hardest hit. And this is because of the context of the current situation, but also because the standard mechanisms for accessing healthcare or informal support are disrupted. So people might find it harder to access medicines or have their typical therapy. And there's disruptions to way of life, like I said, that can have ripple effects for mental health, both because our way of life is being changed, and the uncertainty that comes with that, but also because our standard coping mechanisms, whether it's seeing our friends or going to work or whatever it is, have been taken away to some degree. And so all of this can lead to an increased demand for mental health need and mental health support, but also at the same time a reduced capacity of our systems to respond. And so we're having to see this transition in how mental health care is delivered. And when we think about crises in general, we need to think about how we adapt and respond, and both try and prevent these effects occurring in the first place, but once they are occurring, how we best respond to meet these needs. So if that's the sort of link with what's going on right now, hopefully that draws out for you a little bit that when we're going through crises, this has implications for every aspect of our society, but also, and maybe sometimes in particular, for our mental health. So when we bring it back to the climate crisis, How does that make you feel? Again, if you're someone listening to this talk and you've read the news and you know what's going on, you've probably had some sort of response. And different people will feel a whole range of different things. But what makes the climate crisis different from COVID or from other crises? Obviously, a whole range of things, but again, just brainstorming. Some of them might be that it's an abstract or complex threat, and so it's difficult to engage with. It's hard to sort of pin down in some ways, and it can feel a bit like this abstract looming thing, but it's also a slow moving crisis, and so these sort of future impacts are a bit delayed, and that can mean that some people live for longer in denial because they don't see those immediate changes. But for the people who realize that they're coming, I guess there's extra frustrations then in trying to convey that message of the changes that are needed now. We need system changes that are long term, but knowing how we as individuals can be part of that change can also sometimes feel overwhelming, because we can feel a lack of agency as a very small part of a big problem. And it's not as simple as knowing that, okay, in this situation, if I'm staying at home, I'm doing my bit. Our relationship with nature is also fractured in the climate crisis and the ecological crisis. And many people are witnessing vast changes to their homelands and their way of life as a result. So I hope that starts to illuminate that there are implications for how we think and how we feel because of the climate crisis. And this is something that has been anecdotal, but is also receiving increasing research, policy, and media coverage in recent years. So if you take a look at this plot that I just did from looking at PubMed, looking at climate change and mental health, even back in 2005, 2006, there were like no articles, whereas 2019, you can really see it was starting to grow quite rapidly, some might say even exponentially, that it was nearly 40 articles. In 2017, the American Psychological Association published Mental Health in Our Changing Climate, Impacts, Implications and Guidance, as they realized the big psychological impact of both climate crisis awareness, but also as the changes started to happen, what that could do to people's mental health. Nature Climate Change has done a focus on mental health a couple of years ago, and we're seeing this happening in policy circles as well, and also in a whole range of popular media articles, from the Rolling Stone to the Guardian, Quartz, and many other articles. So today I want to talk through the indirect effects of climate change on mental health, this bottom part, around what we've sort of highlighted before around community breakdown and these different psychological responses we might have, and eco-anxiety, if you've heard of that, and ecological grief. But I also want to focus on something people might be even less aware of, the direct effects of climate change on mental health. So how higher temperatures and heat waves and more acute and long-term extreme weather events might directly impact our mental health systems and mental health needs. So again, most of this you might know, but just to reiterate, the climate crisis brings more carbon dioxide to our atmosphere than at any time in human history. We've already had 1 degree of temperature rise, and we know that this is continuing. And this is going to lead to higher average temperatures and more frequent and extreme heat waves, but also more acute and more chronic extreme weather events that are more frequent and more severe. Again, before I dive into the details, I also want to outline what I mean by mental health and mental health outcomes. And I could do a whole talk just on this alone, because as more and more frequent these terms are used, they're also still not fully understood and defined. But when I'm using these terms, what I mean is that mental health is something that everyone has, just as we have physical health, and that we all exist on a spectrum, so that our mental health can go up and down at any time. And when we talk about this sort of population mental health, often people also talk about well-being. So good mental health is about being able to flourish in your work, your relationships, all aspects of your life, and really not just to be going okay, but to feel like you have everything you need to thrive. Impacts of mental health can be worsened across the population, but also uh, separate to mental health, we have mental illness, which can be diagnosed mental illnesses like depression or anxiety or schizophrenia, etc. And so when we talk about the impacts of climate change on mental health, we can talk about mental health across the population. We can also talk about symptoms of specific mental illnesses. And we can also talk about physical health or other outcomes being poorer for those with pre-existing mental illnesses. So now I'm going to dive into the direct effects of climate change on mental health. And one of the direct routes by which climate change may impact mental health is through increased temperatures. And what the literature shows is that when we have either longer term warming trends or also heat wave events, we get increases in suicide rates. We also get increases in emergency room presentations for mental illness. And this has been shown in high resource and low resource settings around the world. And that might be quite surprising for some people because, just because it's hotter, we might not expect that to have any relationship to mental illness or suicide outcomes. However, there's a range of mechanisms by which this might happen, and I'll go into those in a minute. Also, heat-related illnesses and physical distress can be higher for those with pre-existing mental illnesses. So this can be caused if, for example, you're on medication for something like schizophrenia. That can interfere with your body's ability to regulate temperature, and so you're more vulnerable to the effects of heat. And one systematic analysis then found that pre-existing mental health problems or mental illnesses tripled the risk of any cause mortality during a heat wave. So this is something that we really can't ignore, and we really need to raise awareness within our health systems and within the general population, so people are aware that if they're on these kind of medications or they're caring for someone who is, that we need to understand that this is a vulnerable population when we have heat waves, just as elderly and other populations that we really need to make sure that we're taking extra care of in these times. Increased temperatures, though, can also worsen general population mental health, so no one is immune to these effects. And what recent studies have shown is by looking at Twitter data and the likelihood of a tweet containing depressive language, or from surveys such as the Centre for Disease Control surveys that are run sort of continuously. When we look at this data and look at how depressive language on Twitter or people reporting mental health difficulties on surveys correlates with monthly temperature, we see an increased probability of reporting mental health issues or an increased likelihood of a tweet containing depressive language as the temperature rises, and also across multi-year warming. So this is like slow effects also increase reported mental health difficulties. So a 1 degree increase in average maximum temperatures over multiple years led to around a 2% point increase in reported mental health difficulties, which might not sound like much, but as a population level, that's a lot of people having worse general mental health just from a 1 degree increase over time. And so we can see that this data is from the US, and this color is the days with maximum temperature over 30 degrees, which is where we saw this sort of worsening mental health. And we can see that as we go towards the end of this century, we imagine models suggest that there's going to be a lot more days like this. And so the probability of reporting a mental health issue is likely to rise in many of these areas. So what are the potential mechanisms for this? Because it might be surprising that just higher temperature may lead to you feeling more depressed, or for people to have more likely to need hospitalization or higher suicide rates. One thing that could happen is that your sleep's disrupted, and we know more and more that sleep is really important for mental health. But with heat, we can have worse sleep. As I said before, if you're on certain medications, you might have impaired thermoregulation. It also changes your blood flow with temperature, and this can lead to different cognitive effects. Again, we need more research about some of these mechanisms, but there's also changes in our societies that can happen where people can feel more aggressive, or there's reduced economic output with higher temperatures, and this can have flow-on effects. Okay, so as well as higher temperatures, though, we know that climate change will lead to more natural disasters, more frequent and more severe. And this is also a problem for mental health, as you might imagine. So in emergencies generally, the World Health Organization says the number of people with mental disorders is estimated to increase by 6 to 11%, which is quite a big jump. Especially because in those emergencies, the ability to access appropriate mental health care and resources might go down significantly. Another review from a couple of years ago showed that inattention to mental health is of particular concern in the field of climate change, given the evidence that psychological impacts from any form of disaster can exceed physical injury by 40 to 1. So you're 40 times more likely to have a psychological impact than a physical injury. And these can be a whole range of different impacts, such as post-traumatic stress disorder, but also things like recovery fatigue, anxiety, grief, substance abuse, survivor guilt, or suicidal ideation. And so what we really need to ensure is that when we're responding to these kind of emergencies, we need to have that in our minds, in our policies, and in our emergency response, so we can really help communities limit the mental health effects of such natural disasters. And research shows that the way those disasters are managed can have big and real differences to long-term mental health outcomes. And that isn't just from the mental health support provided alone or the community support provided alone. It's also from how people get access to appropriate housing, for example, afterwards, or insurance payouts happen, or things like that. And so it's really important that we understand those links, so we know that when we put in policies around emergency provision, that we take into account that those policies will have mental health implications. But over longer periods of time, we also see similar effects. But of course, the way that this plays out will be different if it's over these longer time scales, when we're seeing slower changes to landscapes and livelihoods and rising sea levels, for example, or episodic drought. But again, these can change the landscapes and disrupt the systems, and entire communities can be displaced, though this can also happen, of course, with more acute natural disasters. We get long-term changes to land use and habitation, and people might never be able to go back to those areas in the way they could maybe after a more acute weather event. And we see this in Australia, where I'm from, again, from prolonged droughts, and this can lead to worsened mental ill health, and we're seeing increased likelihood of suicides and more psychosocial distress in the population. And this is from New South Wales, from a 2012 study that showed that particularly in young men, or people aged in particular between 30 and 49, we saw the relative risk of suicide increased with increasing drought index. And so as these droughts go on, and there's big implications for whole communities and livelihoods, this has implications for mental distress and suicide in these populations. And we really need to be providing appropriate support. Okay, so what if you're not experiencing these extreme weather events or temperature changes directly? What about all of those other sort of responses that I spoke about at the start of the talk, like eco-anxiety? So eco-anxiety came into the lexicon last year with a whole flurry of articles, and it's been defined by the American Psychological Association as the chronic fear of environmental doom. And there was a whole bunch of articles about this last year. But what does it really mean? Well, it can be linked to things like panic attacks, a loss of appetite, insomnia, or obsessive thinking, which is related to lots of other forms of anxiety as well. And we've seen it reported anecdotally from people like young climate activists or people who work in this field, so climate scientists, for example. But unlike other mental illnesses where or other types of anxiety, where there's often a sense that the worries might be irrational to some degree, with eco-anxiety, what a lot of psychologists are saying is that this is not a new illness, but a rational response potentially to the facts, or part of a healthy range of processing. Though, of course, if that level of anxiety or worry becomes so intense that it is affecting with your sleep or your ability to think or function, then of course it does need appropriate support to process that in a healthy way. But being anxious when being aware of the climate crisis is part of a range of responses that might be quite justified in light of the facts. But that doesn't mean that, we leave people to deal with that. We need to provide appropriate support and understand that there needs to be a space between awareness and taking action to process appropriately and to provide that support for people to do so. So despite all of these articles, there's not a lot of concrete evidence or literature around who is affected and why and how by eco-anxiety. So we don't know a lot about the true nature or prevalence or severity of these types of responses. Yale has done a lot of work on how people feel in response to climate change, and if people believe global warming is happening, then they feel a whole range of emotions, and this can include, for example, 82% being interested in global warming, but also feeling disgusted, helpless, afraid, angry, hopeful, or outraged. In the UK, there was a smaller survey that found 40% of 16 to 24-year-olds feel overwhelmed by climate change. And in the US, 72% of 18 to 34-year-olds report negative news stories about the environment sometimes impact their well-being. But these are small-scale surveys largely, and what we need is actually more research to really understand who is affected and why and how. What are the true nature and prevalence and severity of what's going on? And again, as I said before, we need to understand the difference between this sort of rational response to the facts, or part of a sort of a healthy processing of what's going on, versus when it gets to the point where people might need more medical support. But one study showed that there was no real correlation between people having a tendency to be anxious in general and their likelihood to be worried about climate change. So this is not the case that it's just people who are anxious already who are now just feeling anxious about something else on top of their other anxieties. This is people being anxious about climate change who might not be anxious about other things. Of course, some of these people might be anxious about other things as well, but it's just not the case that this is only happening to people or who already have anxiety. But apart from anxiety and eco-anxiety, which tends to get a lot of the press, there's a whole other range of responses, as we were sort of talking about at the start, that might happen in response to the climate crisis. One thing is grief, and people are talking about ecological grief, or solastalgia, coined in 2007 by an Australian academic. And what these terms have been said to mean: ecological grief is the grief that's felt in relation to either experienced or, importantly, or anticipated ecological loss. So it's not only that we're already seeing these changes, it's that people are anticipating these changes coming. And this can be due to acute environmental issues or long, chronic, or creeping changes. So I know that having swum on the barrier reef when I was younger, when I see images of the coral bleaching, I feel an enormous sense of grief that can feel very, very personal. And the same with bushfires, or watching koalas near my family's house, really struggling in the intense heat waves. But for other people, it might be seeing the landscapes, of their farm, or things that are very central to their livelihood or way of life also change. And solastalgia is said to be a kind of like a homesickness, where you're at home, but your home environment is changing around you in ways that you feel are profoundly negative. So it's not only linked to the climate crisis. It was actually coined in response to looking at people in the Hunter Valley region of New South Wales in Australia, with mining happening in their region. But when we see these changes around us that are profoundly negative, that has an impact on how we feel about our sense of home. And so some examples to really bring this to life: people who are already experiencing these climate crisis changes, like the Inuit in Canada, when they've been interviewed, they've spoken really powerfully about the impact the changing climate is already having on mental health, with increased anxiety, sadness, anger, grief, and loss in their communities. And I think this quote is particularly poignant. It says, "We are people of the sea ice, and if there's no more sea ice, how do we be people of the sea ice?" And that's from an elder in one of these communities. And I think that really strikes at how this is, the climate crisis can really hit people's identity. In Australia, as I said before, there's drought having impacts on family farms. And one farmer said it would be like a death. Yeah, there would be a grieving process because the farm embodies everything that the family farm is. And I think if we were to lose it, it would be like losing a person, but it would be sadder than losing a person. And in the UK, Zadie Smith, the author, has said, people in mourning tend to use euphemism. The most melancholy of all the euphemisms, the new normal. It's the new normal, I think, as a beloved pear tree, half drowned, loses its grip on the earth and falls over. We can't even say the word abnormal to each other out loud. It reminds us of what came before. And this can happen to anyone, of course, that we feel this whole range of emotions and responses. But there's particular groups that might be impacted most. So as I said, children and young people and activists and climate scientists, but also schools and teachers, those who are already directly affected, parents and potential parents who are reporting either concerns for their own children's future, or that their children are very anxious and upset and they're not sure how to comfort them. And also policymakers and those working with policymakers might, their response and their psychological response might have a big outsized impact, because what we also see is that there is a relationship between anxiety, or this whole range of psychological responses, and taking action. And it's really important to understand that the climate crisis is a human crisis, and it's about human behavior. And so if we want to understand how to get people to act and how people respond to narratives, we need to understand humans and we need to understand psychology. We need to also understand that it's very easy to go from ignorant to overwhelmed. And this can lead to people feeling like a sense of fatalism, and fear that can be helpful, but it can also be paralyzing. And so I think there's been a lot of debate around the power of different climate narratives and how they may reach different people. So different people will respond in different ways. And so when someone like Greta Thunberg says, "I want you to feel the fear I feel every day," to world leaders, then I want you to act. We need to understand how that fear can drive some people to action and some people to paralysis. And we need to really give a space between knowing the facts or becoming aware of these issues, and coming to terms with what they mean for us and our societies, and how that can lead into action. And this works the other way around as well. The more we act, we see that is, anecdotally and speaking to psychologists, one of the best ways to actually look after our mental health and well-being in the face of these changes, and to take back that sense of control, and that sense of charting the course towards the future that we want and we want to be part of. So action is one of some of the advice that's given. Again, I'm not a clinician, but from those who are, to reduce eco-anxiety. Other ways are to talk to like-minded people, parents to acknowledge the feelings of the children rather than just trying to placate them, and acknowledge that there's facts behind them, but really importantly to take action as individuals and also as communities. So for politicians to show that they are taking action, and for people to feel like that we're working towards this together and towards this new world together. And we can see this, many of these things now, again, if we look at the current situation with COVID, these same sorts of dynamics can play out between how people feel about the situation and how their leaders are responding, or how what individual actions that they're taking or willing to take. But this has really positive implications for climate change in many ways, because if we can really understand and meet people where they're at and help them to process and help them to take action, then that has positive implications for them and their mental health, but it also has positive implications for climate change. So borrowing from Richard Carmichael, one of my colleagues, he has drawn this diagram of how these sort of feelings related to climate change can lead to avoidance on the one hand. This can lead to a visible lack of progress and continued barriers, which again leads to lower self-efficacy and apathy and depression. But on the other hand, if we allow this to lead to action, this can lead to shifts and co-benefits to our mental health and our societies, and a positive vision of the future that leads to and feeds back into higher engagement and well-being and self-efficacy, which can lead into more action. So we need to acknowledge and support the mental health impacts in those affected or at risk, either directly from higher temperatures or extreme weather events, or from this indirect awareness of what's happening, and also focus on translating that emotion into action as both a coping strategy and to support the climate mitigation or adaptation efforts. So how we can do this is through either digital tools, which obviously everyone's using right now, a focus on community and connection, and also focusing on this ability to work towards a positive trajectory and this sort of co-benefit story, that when we take action on climate and we work towards taking those steps towards the future that we want to see at any point in the curve, whatever's going on, we can choose to take the steps towards what we want to see, and then this has co-benefits for our mental health as well as climate action. There's already groups that are springing up to support mental health in the face of either extreme weather events or also this indirect awareness and psychological distress in the face of climate crisis awareness. And we're seeing that, for example, climate crisis activism may reduce mental health symptoms among young people. There's things like the Good Grief Network, which are helping people through, or the Climate Psychology Alliance. But again, there's very little academic research to understand the true nature or prevalence or severity of how people are responding to awareness of the climate crisis, and how this relates to action. So what we need from here is we need to add to the growing body of evidence around how direct effects like temperature or natural disasters influence mental illness and mental health outcomes. There is already an evidence base, but we need to grow this, and we need to increase awareness of this. But we also really don't know the extent of many of the issues, particularly the indirect issues like that flow from this awareness rather than direct experience. We need this sort of globally in all different income and resource settings. And we need to understand that there's complex links between climate change and mental health, as I hope that I've sort of touched on. So we need systems thinking where we understand all these parts of the system. And then we need to understand how best to respond by all areas. So to summarize, climate change can have impacts on individuals and communities. Awareness of the current and future impacts of the climate crisis can lead to a range of psychological responses, and we need to appropriately manage those and support communities. It can also lead to strain on healthcare systems. So the climate crisis is a healthcare crisis in many respects, and we need to ensure that mental health is part of that conversation. It can disrupt current mental health systems and also increase mental health needs. Um, it's also important to note that the climate crisis is a human centered crisis, and so psychology is at the heart of climate action. And understanding the relationships between these psychological responses and the actions that we take, both as individuals and communities, is really important. So we need more research, we need more awareness, and we need more innovation. And this needs to be at all different levels, so locally and globally, and at all different levels of policy and healthcare systems and emergency responses. And we need to work out how to support individuals and communities, drawing on current relevant clinical and academic expertise, and also community knowledge and Indigenous knowledge. And I think that if we do that, then we can work towards that positive vision of the future where action on climate creates a better world for our mental health and well-being as well. So thank you very much for listening.